Good evening, ladies and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to another episode of Prostate Cancer Awareness Series, which is brought to you by the IHW Council and powered by AstraZeneca Pharmaceuticals. So today we will be discussing about how to combat and win over prostate cancer. And to discuss about this very critical health issue, I have with me Dr. Manish Sharma, who's a senior consultant medical oncologist at AXA Cancer Hospital. Thank you, sir, for ensuring your commitment and being part of the Prostate Cancer Awareness Series. On behalf of the Council, I welcome you to the discussion.
Thank you so much, and good evening to all of you, whoever has joined us, and especially you, because you have brought such an important topic to the public.
Right. So, Dr. Manish, as you yourself said that it's an important topic. So, I'll first come to you with the very basic question that if we have to, describe somebody to, what prostate cancer is and what are the risk factors, which, further can give an information to our viewers on this very important aspect. So please enlighten us on that.
So first of all, we should know that prostate is present only in men. So it is a gland that is situated just behind the urinary bladder. So जो पेट का जो लोअर वाला हिस्सा होता है, नीचे वाला हिस्सा होता है, उसमें प्रोस्टेट ग्लैंड एक सिचुएटेड होता है that helps in some reproductive functions, and it is not present in the woman. Hence, the prostate cancer can happen only to the men, and it does not happen to the woman. Number one. Number two, the tendency of having prostate cancer, it increases with the age. So above 55 years of age, the chances of men getting prostate cancer, it increases significantly and quite a lot. So there are two types of enlargement of prostate. One have to remember, when someone says that I have a prostate problem, so it can be of two types. One, it is called as benign prostatic hyperplasia. This is the condition which is non-cancerous. ये वो गांठ है जिसमें घबराने वाली बात नहीं होती है. एक दूसरी तरीके की गांठ होती है जो घबराने वाली थोड़ी सी हो सकती है, especially when it is prostate cancer. So this is the enlargement of the prostate that is cancerous and can create some of the problems. So secondly, you asked about what are the risk factors for having a prostate cancer. So being a man is a first risk factor because it doesn't happen in women. Second, very important thing that it occurs almost exclusively in the older age population. So most of the time we will see that older patients coming to us with some urinary complaints like dribbling of the urine or incontinence of the urine. So most of the time this cancer happens in males with the increasing age. Second important risk factor, third important risk factor is having family history. If someone of your relative, first degree relative or second degree relative like brothers or a father had this type of cancer, prostate cancer, or sister or mother had some kind of ovarian cancer or colorectal cancers, then the chance of getting someone prostate cancer increases. Other important risk factors are obesity. So obesity is one of the very, very important risk factor for having prostate cancer, especially those people, those men who have BMI of more than 30. And then smoking is another risk factor for having prostate cancer at an older age.
Dr. Manish, since you talked about how age is an important risk factor, and then of course your gender. So when you've talked about how the older population is of men are more prone to that risk. So when we talk about the detection methods, at what age, because there are a lot of not a very clear answer that patients have, or even normal people who would want to go for the tests or PSA. So at what age should men go for those basic detection tests?
So first of all, the cancer can be detected by two methods. Number one, one should be aware of the symptoms that are caused by prostate cancer. So if someone is aware of the symptoms that are caused by prostate cancer, then probably he will reach the doctor early, he will reach the cancer specialist early, and then the treatment can be initiated at the early stage. And the symptoms of the prostate cancer are almost similar to what we call as a non-cancerous prostate growth, that is benign prostatic hyperplasia. So it is incontinence of the urine, dribbling of the urine, stream of the urine is not proper. Then sometimes there is blood in the urine or blood in the semen, or improper ejaculation is there. So these are all the signs and symptoms of the prostate when the prostate is in early stages. It causes severe bony pains or some liver dysfunction once the prostate has gone to the other organs like bone, when it is called as stage 4. So number one, the symptoms should be clear to the to the people, that if someone is suffering from these symptoms for a prolonged period of the time, then probability of having prostate cancer is high, and he or um, he should see a doctor. He must see a doctor. Second important thing is age. Sorry. Second important thing is screening of the prostate cancer. So screening would mean that जैसे कि हमारी गाड़ी खराब नहीं हुई है और we take our car to the service, although there is no breakdown in the car. So similarly is the concept with the screening, that the body is okay, but we are just screening to know whether the prostate cancer is present or not. And this should happen at least when the person has become more than 55 years of age. So it is conducted by just a simple blood test, which is called as prostate specific antigen, that is PSA. And another test is called as digital rectal examination. This is done by a urologist or a cancer specialist. The urologist would feel some kind of nodule or some hardness in the prostate just to determine that someone is suffering from prostate cancer.
That is a very nice overview you have given of early symptoms and signs. But many a times, Dr. Manish, the signs may be confusing, the early symptoms, because there are certain other conditions also which may have a similar, symptoms when we talk about prostate cancer. So, of course, early detection, early diagnosis is important to ensure that, you get your treatment started. So when we come to the treatment modalities, how would you define those, especially like you touched upon how stage 4 is a different scenario altogether and stage 1 is a, so depending on the stage of cancer, I'm sure the modality treatment modalities must be depending on them. So just give us an overview of those stages and what treatment would you suggest for that specific stage.
So early stage, a locally advanced stage, and stage 4. So these are 3 different stages. So, or you can say these are 4 different stages. Early stage cancer is just localized to the prostate. It has not gone anywhere else. While the loco-regional advanced prostate cancer, they start invading the organs which are around the prostate. And the 4th stage of the prostate, which is called as metastatic disease or 4th stage disease or last stage disease, when the prostate cancer has gone to different part of the body. That is, it has gone to liver, it has gone to bones, it has sometimes gone to the lung or lymph node. So it is called as stage 4. So whenever any person is coming to us with the symptom of prostate cancers, we first advise the ultrasound of the kidney urinary bladder, so as to look at the size of the prostate, what are the focal signs in the prostate, and then we just order for a MRI of the prostate. So we should know that once the doctor is going to treat, he must know 2 important things. One is the kind of the prostate cancer which person has, and another is what is the stage of the prostate cancer. So for for the type of the prostate cancer, it is needed to do a biopsy, which is called as which is done by endorectal route. Biopsy is done. Second important thing to know about the stage. So this stage is known by with the help of MRI. MRI would tell that prostate cancer is just localized to the prostate or it has invaded the outside structures. And then the doctor would order a PSMA PET CT scan. And this PET CT scan would help us, or a bone scan would help us know whether the prostate cancer has traveled to different part of the body. So two things which doctors want to know. One is the stage of the disease. Second is the type of the disease. So once someone is suffering from prostate cancer, he must be coming around and asking what is the grade of the cancer and what is the stage of the cancer. So it is important to know that the stage is different and grade of the cancer is different. So grade is called as Gleason's grade, and this is between 6 to 10. So the Gleason's grade means that the cancer is dividing very slowly or very rapidly. So Gleason's grade 6 is very slow growth of the cancer. And Gleason's grade 10 is very fast growth of the cancer. It has nothing to do with stage of the cancer.
Right, Dr. Manish. So you have very rightly pointed out that there, many people have this confusion and miscommunication on the different aspects of how a grade and a stage is classified. Coming to the treatment, you have touched upon the treatment modalities, how but when we talk about these treatment modalities, there are a certain side effects also there, because there is one misconception. Many people say that the treatment is sometimes going to hamper your quality of life and may negatively impact your holistic well-being. So with these newer technologies and innovations, I'm sure that the side effects have gone down drastically. But what about some of the other concerns that the patients have? How do you counsel them and ensure that they take the necessary step and that reluctance is bridged?
So one must know that not all patients with prostate cancer will need treatment. So prostate cancer is one of the cancer which can be very slow growing and which can be very fast growing. So not all patients will require treatment for prostate cancer. Some of the patients we can keep on active surveillance. Active surveillance means that we frequently monitor with the help of an MRI, or we frequently monitor with the help of prostate specific antigen. And these are those patients who have low grade cancer that I just discussed that the grade of the cancer. So if we have to detect the cancer early at the earlier stage. If the patient is suffering from stage 1 disease or early stage disease, treatment which we give is just a finite amount of treatment. So treatment would last for 2 years or 3 years, not more than that. And in this case, the surgery is very important. If the patient has the localized disease, cancer has not traveled anywhere else, the surgery is very important. So earlier, we used to have very bad scarring, very bad scars, big scar on the abdomen to do a prostate cancer surgery. But now we have robotic surgeries available with us, especially for the prostate cancer. It is extremely helpful. So patient, they become ambulatory very quick early on. Second important thing these patients require is radiation treatment in the early stage disease. It is not given in the late stage disease. So early stage disease, number one, surgery, very important. Some of the patients would not opt for surgery or will not benefit from surgery, and these patients, they are referred for a radiation. Radiation is just a machine that concentrates multiple rays of X-rays on the prostate and kill the prostate cancer cells. Along with this, the patient is given some hormonal injections also. But if you have a stage 4 disease, then this is a late stage disease and it is not curable. But definitely with the newer treatment available, it is controllable, and treatment is not finite. It is the indefinite kind of treatment for these patients. And as you mentioned that the treatment has some concerns as well, because some of the side effects will be there. So once the patient has a stage 4 disease, we give hormonal therapy, hormonal treatment to the patient. So how does the hormonal treatment work? So it is important to note that the prostate cancer cells, they thrive on the male hormone, which is called as testosterone. So testosterone is a hormone which causes a prostate cancer cell to grow. And these patients, they are given the some injections to stop testosterone in the body, so as to decrease the tumor burden, tumor cells in the body. So these will have different kind of side effects as well. These are not without side effect. Surgery can lead to some kind of sometimes urinary incontinence, which gradually comes back to the normal. Sometimes, very rarely, it can lead to improper ejaculations or erectile dysfunctions. Similarly, the radiation treatment can lead to these kind of problems such as incontinence. It can happen with radiation also. Proctitis, that is the inflammation of the rectal part, colorectal part. Proctitis can happen. And with the hormonal treatment, there are multiple other problems as well, such as increase in sugars, increase in weight. The fat becomes very on body. Obesity can happen. There is deranged lipid profile, lipid function will become sometimes deranged, and the bone functions also become deranged. So osteoporosis can happen. But as we know that these are the side effects of the treatment, but we should also note that there are multiple treatment available to counter these side effects.
Dr. Manish, that was a very, very informative answer. You know, when we talk about these treatment modalities, and especially with something like cancer, there are a lot of myths associated. So it is really, important that we address those myths and make sure that people have that, correct information. Now, talking about, since you talked about the fourth stage also, where there is no treatment available. So, how important is counseling when we talk about that? And of course, integrating palliative care in the whole approach. How is that in short?
No, I never said that there is no treatment available in stage 4.
Yeah, I mean, when I will take back my words, but yes, when you said that at the fourth stages, it's already spread,
And I said that the treatment which is needed is not finite, it is an infinite.
Infinite, exactly.
And
So,
it is very, very important to note that the prostate cancer is a cancer in which, even with the stage 4 disease, patients sometimes can live very, very long.
Health outcome is very good. Yes.
Sometimes they can live for 4 years, 5 years, 6 years, depending upon what is the grade of the prostate cancer.
Prostate, exactly.
So there is a treatment available. And yes, the palliative care is also very, very important. Once the stage 4 comes, then there can be problems with the pain, or most of the time patients, they are older age patients, they need some social support as well.
Right.
So here the role of the pain physicians also comes in, palliative care teams role comes in, and the social support also very, very important for these patients.
When we talk about social support, I'm sure that there are role models and support groups, because there are cancer patients who have successfully won over and completed that journey, and they are referred to as role models for such patients. So when we talk about support groups, and of course platforms where patients can come together and discuss their experiences, motivate each other, you think that can play a very important role in that kind of giving that mental support, emotional support to the patient?
So I think sorry, the getting a treatment for cancer is a mind game. So it is a very long journey which cancer patients they have to face. Sometimes the treatment goes on for 6 months or year, and many other problems also comes in, and hence the role of social support or role models is very important. And being positive at this point in time and knowing the appropriate treatment which is available, it is very important, so that the patient goes to the right person. And especially the role there comes a role of relatives, there comes the role of friends, which can motivate and keep the patient in a positive attitude, so as to patient can complete the whole of the treatment. Many times we found that the cancer is taken as a stigma in our society. So instead of the people helping the cancer patient, they just maintain some distance from the cancer patients, and they are sometimes discriminated at the workplace also. So once the patient is cured of and goes back to the society for his or her daily activities or work, sometimes the people they just see them like कि ये तो बेचारा हो गया है, इसको तो दोबारा से आ सकता है cancer. So it should not happen with those people, and the friends and family members and the near and dear ones, they should definitely support them.
Right, Dr. Manish, very rightly you have talked about. So when we talk about the importance of counseling and emotional support, it is important that that stigma that is there, that is no, that needs to be addressed in a proactive manner. Now, when we talk about the treatment modalities post the treatment, because as you said, it is in some cases it is infinite, and then of course it's not, the follow up is important, because it's not that okay, you got the treatment and even if you are cured, you have to go for that follow up. So how important is follow up, and what are some of the considerations that patients have to ensure that are being met when follow up is discussed?
So you rightly said there are some of the patients, mm, unfortunate patients. So I would not say unfortunate patient. It's just a luck that the cancer comes back in those patients, in spite of getting the right and appropriate treatment at the appropriate time. So it is very important that the
You are on mute. Yeah, now we can hear you.
patient remains in the follow-up care of the doctor who is treating the patient. And number two, most of the time we ask the patient to visit us at approximately 3 months time, so as to see that if the cancer is coming back, we can just detect it early and start some treatment.
Right, Dr. Manish. So, since you have covered the whole aspects in a very, holistic manner, quality of life of patient is very important, like we discussed at the beginning of the discussion. So, when we talk about caregiving, caregivers who are there, and once the treatment is over, and we want to maintain that quality of life for the patient, so you think there are certain small changes that they can make when it comes to their diet, their daily regime post the treatment, which can help them maintain their quality of life and ensure better health outcomes for them. Please shed light on those changes.
So, along with the better quality of life, if we instigate few of the important things like healthy lifestyle or doing exercises or yoga, so as to maintain a healthy weight and avoid smoking, which is very important risk factor for the cancer coming back. So these are 3 4 very important things which once the cancer patient is treated, we ask all these things for a cancer patient, so as to uh, keep the cancer at bay.
Right, Dr. Manish. Since we are already, at the end of the discussion, I would just want you to, give a message for all those, viewers here who are watching us. First, for all those who you would want to go for, early, to go for diagnostic tests, because in India, people are reluctant, अरे नहीं मुझे कैंसर मुझे नहीं हो ही नहीं सकता. So the importance of going for those tests and ensuring that they are in the best of their health, like you said, ke, you need to take your car for servicing even if it doesn't have a problem. So please give us a message on how when it comes to early diagnosis, going for those techniques, tests, how important is that?
So आपने जैसे बोला कि कैंसर मुझे हो ही नहीं सकता, अभी कैंसर तो मुझे हो ही नहीं सकता, but it should be known that any human being which is living in the earth, which is living on the earth,
yes, can have
cancer.
Yeah, that is the blockade that I was referring to, that many people in our society have.
And we can see that many of our film stars even. So recently we know that Sanjay Dutt had lung cancer, then Yuvraj Singh had some germ cell tumor, then Miss Manisha Koirala had.
She also opened up about her journey.
Did a treatment for cancer. So Lisa Ray had multiple myeloma. So these people can have cancer. So we are the part of the same society, and probably the risk factor which these people have, we also have those risk factors.
Exactly.
And hence, as we told, that servicing is very, very important. Screening is very, very important. And with the this program, I would say a message to the people around that we should screen our body for different kind of the disease. Like we screen for cholesterol, we screen for heart diseases nowadays, we screen for blood sugar. Cancer should also be screened. And since this is a prostate cancer talk, I think I should say that with the older age, with the age of 55 years, there should be an adequate discussion between doctor and the patient to do some prostate specific tests so as to detect the prostate cancer early.
Right, Dr. Manish. And any message that you would want to give to people who have been diagnosed with, or maybe who had their treatment journey completed? Any major takeaway that you would want to talk about?
For those who have conquered this, the important thing is to have healthy lifestyle, avoid smoking, keeping the weight in control, avoiding the alcohol, which are important risk factor, which we know, going to the doctor at the regular time, doing the checkups. And for those who have been diagnosed recently, I would say that you should not break your heart. There are plenty of the treatment around, plenty of the doctors there around. And the treatment is finite for those patients who have the early stage disease. So just give yourself a boost and take the treatment.
Right, Dr. Manish. Very rightly, you have pointed out about how, taking the right medical intervention at the right time is very important and can play a major role in, for your health. And I would once again want to thank you for taking out time from your busy schedule and joining us today for this awareness session. And I'm sure that our audience, they will get inspired by this session. They'll go and start treating their bodies as something that they have to take care of, because we Indians don't prioritize sadly health that much. And thanks for being with us. And that's all for today, everyone. I'm sure that you enjoyed this discussion and this very engaging session, and we'll see you again in another awareness series. Until then, please take care of your health, stay safe, stay happy, and take care. Thank you, Dr. Manish.
Thank you so much.
Thank you.